Use of adenosine injection. Adenosine injection is a medication used in the treatment of certain heart rhythm disorders, such as supraventricular tachycardia. Adenosine is a naturally occurring substance in the body that helps regulate heart function. When given as an injection, adenosine works by slowing down the electrical conduction in the heart, which can help restore a normal heart rhythm. It does this by temporarily stopping the heart and then allowing it to restart with a normal rhythm. Adenosine injection is typically given in a hospital or clinic setting by a healthcare professional. It is administered intravenously, and the dosage and frequency will depend on the individual patient's needs and condition. Dosage of adenosine injection. The dosage of adenosine injection will depend on various factors such as the patient's age, weight, medical condition, and the severity of the heart rhythm disorder being treated. In general, adenosine injection is given as a rapid intravenous injection of 6 mg over 1 to 2 seconds, followed by a saline flush to help ensure the medication reaches the heart. If this initial dose is not effective, a second dose of 12 mg may be given after the 1st of February minutes. It's important to note that the dosage and administration of adenosine injection should always be done under the supervision of a healthcare professional, as incorrect dosages or administration can lead to serious side effects or complications. Mechanism of action of adenosine injection. Adenosine injection works by binding to specific receptors in the heart called adenosine receptors. These receptors are located on the surface of certain heart cells, including those in the sinoatrial node and the atrioventricular node. When adenosine binds to these receptors, it causes a number of effects that help regulate the heart rhythm. Specifically, adenosine slows down the conduction of electrical impulses through the AV node, which can help restore a normal heart rhythm in certain types of arrhythmias, such as supraventricular tachycardia. Inhibits the activity of the SA node, which can help reduce the heart rate and prevent arrhythmias. Can also dilate the blood vessels in the heart and other organs, which can help improve blood flow and oxygen delivery. Overall, adenosine injection is a useful medication in the treatment of certain heart rhythm disorders because of its ability to regulate the heart rhythm and improve blood flow. However, as mentioned previously, adenosine should only be used under the guidance and supervision of a healthcare professional. Side effects of adenosine injection. Adenosine injection can cause several side effects, some of which may be serious. The most common side effects include flushing or warmth, chest discomfort or tightness, shortness of breath, headache, dizziness or lightheadedness, nausea or vomiting. These side effects are usually short-lived and go away quickly once the medication is stopped. However, if they persist or are severe, it is important to notify your healthcare provider. In rare cases, adenosine injection can cause more serious side effects, including heart block or other arrhythmias, low blood pressure, seizures, allergic reactions, including anaphylaxis. If you experience any of these more serious side effects, it is important to seek medical attention immediately. It is important to note that not everyone will experience side effects from adenosine injection, and your healthcare provider will monitor you closely during treatment to ensure your safety. Advices for taking adenosine injection. If you are prescribed adenosine injection, here are some advice for taking it safely and effectively. Adenosine injection should only be administered by a healthcare professional in a clinical setting, such as a hospital or clinic. Make sure to inform your healthcare provider if you have any allergies or medical conditions, especially heart or lung problems, before receiving adenosine injection. Follow your healthcare provider's instructions carefully regarding dosage and administration of the medication. Be aware that adenosine injection can cause flushing, chest discomfort, and shortness of breath. These side effects are usually short-lived and resolve quickly once the medication is discontinued, but inform your healthcare provider if they persist or worsen. Avoid caffeine and other stimulants before and after receiving adenosine injection, as they can interfere with the medication's effectiveness. If you have any concerns or questions about taking adenosine injection, do not hesitate to discuss them with your healthcare provider. Remember, adenosine injection can be a useful medication in the treatment of certain heart rhythm disorders, but it should always be used under the guidance and supervision of a healthcare professional to ensure safety and effectiveness.